Multiple medications and early signs of liver disease. This is a problem we commonly see in our clinic. Liver disease can be lethal. We're going to discuss a case of a 46-year-old man with just this problem. Welcome to Montgomery Heart Wellness, and we're going to discuss the clinical case of a 46-year-old man who came to us who's on multiple medications and had some early signs of liver disease. Can you tell our audience about this patient?
Yes, so he had a history of some fluctuating liver enzymes, and he also had type 2 diabetes. He took 4 medications, one of which was insulin for the diabetes. So specifically, those were Synjardy, which is metformin combined with Jardiance, Mounjaro, which is an injectable medication that is marketed for weight loss too, and the 60 units of insulin. He also took simvastatin for high cholesterol, and he took amlodipine for hypertension.
This issue is near and dear to my heart because more than 2 decades ago, my mom died of liver failure, and she was on multiple medications, and her gastroenterologist did not understand, why she had liver failure. She didn't have hepatitis, was not an alcoholic, etc. She was diabetic, followed a diabetic diet, etc. Took all the prescribed medications, and after her death, when I reviewed her chart, she was on maybe 10 or 12 medications. About 8 or 9 of those medications were cleared through the liver. And when I start to study this more in other patients, we found that underlying liver problems are not only due to alcohol, but are due to many other factors. And this patient had similar factors. What are some of the things that he had that contributed to his early signs of liver disease?
The main thing was his poor dietary intake. So he ate a lot of meats, fried foods, things with lots of oil, fats, and so that can lead to fat deposition in the liver or just have a directly toxic effect.
So you have a bad diet, which is contributing to the liver dysfunction, contributing to the insulin resistance, therefore elevated blood sugar, contributing to the metabolic problems that's causing the cholesterol to be elevated, and of course have elevated weight. So then what do we do in allopathic medicine? We then give a pill for this and a shot. Yeah. We give a pill and a shot for this, and we give a pill and a shot for that. And we are not treating the underlying cause.
Right.
The pills will, reduce the cholesterol.
Yes, they'll improve the numbers.
They'll improve the numbers, yes, well stated. Yeah. But what do they do to the underlying cause?
They don't treat the underlying cause.
Yeah, and that's the problem. And so in this patient, the underlying cause was really the poor diet. And he really only had one problem, bad fooditis, as I like to say. What did you do with this patient?
So he started the 28-day detox. He was in our Life Source program, so he had a lot of good consultation with us and the nutritionist, a lot more hands-on nutritional training and education. We saw him every week, and he got a major improvement in just the first 3 days. He stopped all of his medications, so even 60 units of insulin, even the injectable diabetes medication Mounjaro, and the combination pill, which we definitely would rather pull medications away and prevent hypoglycemia. If blood sugar might come up a little bit, that's okay, it'll downtrend later. And he tolerated that so well. He lost about 10 pounds. Blood pressure was doing well off the amlodipine.
Yeah, and that's really powerful because, he was on these medications to control these conditions. And as you said, they brought the numbers down. When you put them on an effective diet, and we're not talking about just a little moderation diet, cut calories here and there. As you pointed out so well, that there's a team approach. We have nutrition, we have counselors who work with them. We have a restaurant on site. Many of our patients need lots of support because they're very busy, they have stressful lives, they're working, they're traveling, and so we need to come and help in as many ways as possible. So with this intervention, he had great success in reducing the medications And as a result of this, not only that he reduced the medications, what else happened to some of the key blood tests that we had?
One thing is liver enzymes actually went down and improved and got more normal. The AST, that's one liver enzyme that actually normalized, went down from 46 to 27, and the ALT went down from 48 to 40. So that's probably just by removing the toxins from the diet and then putting in your body foods that have natural antioxidants that are good for liver health anyway.
And the A1C went from 6.8 to 6.3. That's about a 9% reduction in just 6 weeks, while coming off of insulin, Mounjaro, and 2 other Jardiance and metformin. So coming off of 4, blood sugar medicines, his A1C still improved. And of course, this is consistent with our clinical data, where we show a 3.4% reduction in 4 weeks of hemoglobin A1C. Now, many of you may ask, how does the hemoglobin A1C, which is an average of 3 months blood sugar, typically come down so fast? And it's due to the fact that the blood sugar swings. So there are 2 things that contribute to A1C. It's really a sort of a 3-month glucose average, but it also is affected by the rapid swings in blood sugar. And so if you decrease the rapid swings in blood sugar, you can have a very short-term reduction in hemoglobin A1C, and that's why we see reduction in as soon as 4 weeks in our studies, in this case 6 weeks. A simple example of how getting to the underlying cause, as I like to tell patients, you don't have high cholesterol, you don't have obesity, you don't have diabetes, you don't have etc. You have a disease known as an addiction to bad food, or bad fooditis, if you will. In many cases, we address that underlying problem. The manifestation with diabetes, high cholesterol, abnormal liver enzymes, which is only probably made worse with the medications. All of that was corrected by treating an underlying cause.
We removed the cholesterol medication to the simvastatin, and those are known to cause elevated liver enzymes, LFTs. And even with removing that, his cholesterol stayed normal.
Fascinating case. I love it. There's some simplicities here, but there's some underlying foundational things I think we can all learn from. So I hope you got a lot out of that. And as usual, if you have any questions or comments, please leave them in our comment box. Our team will try to address them as soon as possible. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.